When payers ask about your levels of care, clear documentation helps your clinical and utilization review teams explain the rationale. Clinical teams use official ASAM materials, payer rules, and qualified clinical review to support level of care decisions. Your records carry that rationale. Let us walk through ASAM-Aligned documentation workflows and the levels of care for treatment center operators, not clinicians. First, the boundaries. Behave Health is not ASAM, and this is not an official ASAM publication. Use official ASAM resources, payer requirements, state rules, and qualified clinical review for patient-specific decisions. We will cover what the ASAM criteria are, the 6 dimensions, the levels of care, and the documentation workflow payers expect. So what are the ASAM criteria? ASAM stands for the American Society of Addiction Medicine, which publishes the ASAM criteria and its implementation materials. ASAM describes the 4th edition as a person-centered set of guidelines for building treatment plans for addiction and co-occurring conditions. For operators, the practical issue is documentation, showing why the current service intensity fits and why the next transition is defensible. Here is where it breaks down. Intake, utilization review, concurrent review, and transitions all need enough clinical detail to justify the level of care. When that detail is thin, payers can question the level of care, the service intensity, and the continued stay. Documentation gaps turn into authorization friction and continued stay disputes you have to work through after the fact. This is where a behavioral health platform matters. A generic EHR is not built around the documentation workflows payers expect. One boundary up front: the software organizes the documentation work. It never makes the clinical placement decision itself. A generic EHR has no concept of outpatient, IOP, PHP, residential, or inpatient as distinct, trackable programs. Behave Health supports configurable level of care labels and documentation workflows across outpatient, IOP, PHP, residential, and inpatient programs, and it connects that documentation to utilization review, payer authorization, and revenue cycle follow-through. The 4th edition organizes assessment around 6 dimensions. The official definitions live in ASAM's published materials. These 6 dimensions are the lens for every multidimensional assessment. Together, the 6 dimensions cover the whole clinical picture. They span physical health and withdrawal management, plus psychiatric and cognitive needs. They cover substance use-related risks and the environment the person returns to. And they keep the person at the center. Preferences, barriers to care, and motivation. For the official dimension names and definitions, train your team from ASAM's published materials. The levels of care span a continuum of treatment settings by intensity. It runs from early intervention and outpatient services through intensive outpatient and partial hospitalization up to residential and inpatient settings. The specific level numbers, names, and criteria are published by ASAM. Use the official materials for those. The operator's job is documenting why the current setting and intensity fit right now. So, how do you organize the documentation work? Keep it workflow-oriented in 5 steps. This organizes the work. It never makes the clinical placement decision itself. Step 1. Capture the current clinical facts across all 6 dimensions. Record the present state clinical picture for each of the 6 dimensions, so the assessment is genuinely multidimensional. Step 2. Document what the clinician actually reviewed. Capture what the clinician reviewed and weighed, not only what a software field happened to collect. Step 3. Document why this setting and intensity are being used. State why the current service setting, intensity, and reassessment cadence are appropriate right now. Step 4. Track reassessments and level of care changes over time. Log each reassessment and every level of care change so the clinical story stays continuous. Step 5. Connect clinical documentation to the rest of your operations. Tie the documentation into utilization review, billing, and discharge planning so nothing falls between departments. When payers ask you to support level of care and continued stay, an ASAM-aligned packet usually includes a few things. A multi-dimensional clinical summary in current dimension terms, plus admission or continued stay rationale from qualified clinical staff. The current level of care, requested dates, and the review cadence. Treatment plan goals tied to documented needs, and a discharge or step-down plan. Requirements vary by payer contract, state rule, and plan type, so avoid coverage absolutes. Keep documentation clear, current and tied to clinician-reviewed rationale. See ASAM-Aligned documentation workflows built into your platform. See configurable level of care labels, utilization review tasking, and payer authorization documentation in one platform. Book a 20-minute demo at behavehealth.com.